Hello and good morning. I am Arjun Vishwanathan, Chief Research Officer at Strategy, and I'm immensely pleased today to welcome you to the very first episode of the Digital Dialogues, sponsored by Dell Technologies. As corporate India buckles up to weather the storm unleashed by an unprecedented COVID-19 coronavirus, organizations are realizing that traditional business recovery mechanisms and models are perhaps not yet equipped to deal with the levels of disruption that are being experienced. On the same breath, it is, however, equally true that technological progress and, more importantly, technology modernization are trends that are shaping the future. In that sense, perhaps, the current disruption serves as a very natural impetus or a catalyst for adopting newer practices, mindsets, and modernizing technology. To discuss this and much more, we have with us today a very eminent industry leader, Arvind Sivaramakrishnan, CIO of Apollo Hospitals. Arvind and I will be in conversation to discuss the wide implications of how technology modernization can be brought to bear significant value in drafting the future of healthcare and how the humble workstation can perhaps serve as a catalyst to future-proofing business. Arvind Sivaramakrishnan, the man in the hot seat, welcome, and we are privileged to have you here today with us, sir.
Thank you. Namaste.
Arvind, you're at the center of it all. CIO of Apollo Hospitals. You've been at the center of future-proofing technology to precisely address the kind of disruptions that, well, corporate India is experiencing today. What would your opening remarks be on the whole concept of how technology can be brought to bear upon healthcare to deliver superior and excellence in healthcare as we progress over the next few decades?
Arjun, thank you for having me on this session. Healthcare is always going to be a very person-centric subject. And for this planet, a billion or more people on the planet, the demand for healthcare and the supply of healthcare are not meeting eye to eye. And the demand for healthcare is ever increasing. And the consumerization expectation of the delivery of healthcare is ever increasing. And for the number of health workers who are there providing healthcare in the overall health delivery system, the numbers just don't add up to the demand that's happening. The only way by which this demand and supply can be bridged is by the use of technology. And the other aspect of this is by bringing this technology together, we bring in that level of surety so that the technology-driven operations can ensure the least possible to zero errors and thereby a very predictable, evidence-based, quality-driven health delivery. So that's where you're looking at all formats of technology, traditional and disruptive, coming together and ensuring that what we need to do collectively in the health delivery ecosystem happens to everybody's expectation. And this everybody is multiple stakeholders, not only the patients or the providers, but the society at large. So that's really how I see technology ensuring that the best of healthcare can be delivered whenever, wherever, ubiquitous, 24/7. That's really what I think is a possibility, and a good amount of it is happening.
Very interesting set of points there, Arvind. Sir, if I may be allowed to ask you, one of the most fundamental questions that's perhaps in everybody's mind today is that as we move forward, one of the critical aspects of how healthcare is perceived is going to be in this field of experience by itself. And like you so rightly mentioned, it's not just the patients, but it's also healthcare providers and the delivery staff and the entire ecosystem of the hospital, so to say. How do you feel the technology modernization will really play an important role in this? And specifically also for a lot of our viewers, how do you think the workstation is perhaps going to play a pivotal role within all of this?
Arjun, if you can help in unprecedented times, technology can help in outreach. Technology can be made available 24/7, 365. That was probably a 60-day before pitch that would have been required to make. I think now almost everybody at all levels have got a unique representing appreciation for risk management and how risk can actually play out and risk preparedness. And by doing so, I think everybody's got fair learning. I know it's a hard learning, but a very, very solid learning in terms of how it can be devastating in terms of the overall outcome.
Yes.
So I think that's something that is it's a hard lesson and that planet Earth has learned, and I'm really hoping and praying that I think it's a lesson well learned and we can move on rather than continuing to dwell on the aspects of the difficult situation. And in this aspect, like what I was mentioning, I think technology is an integral part to ensure that there is all elements of perfection that is brought into every work process. Again, what I'm saying is definitely not healthcare specific. Every work process that we have, there is a significant amount of wastage that happens in the work process. It's a very normal Six Sigma conversation, nothing unusual. For decades before, the manufacturing and automotive industries have been perfecting the art and science of Six Sigma into their processes. But with the availability of technology, this is something that can be done very, very well. And the focus of ensuring every work process is monitored and governed by practices that are worldwide best practices that are followed, that are embedded into every aspect. That way, the human intervention enabled by technology always brings out only the best and ensures that error rates are almost eliminated and consistency of service is thoroughly maintained without the element of human disruption, because people do make mistakes and people can may not be at their best forms at all points in time.
Yeah, yeah.
And ensuring that services are available across. Making services available across itself brings a huge availability of capacity. In a traditional model, you will probably avail of a service. Again, trying to be as generic as possible, not to particularly refer to healthcare only, but almost any service. So a service may be available, during, if I may call it, daylight, 9 o'clock in the morning or 8 o'clock in the morning to about 7 o'clock. And I think the retail people have perfected it by doing all the midnight sale, which I think is ensuring internet capacity is maintained. I don't think doing a sale in the prime of the day is going to give them the internet capacity, but that's jokes apart. That's a fantastic look at capacity. So you're looking at availability of capacity in what was considered a non-traditional time zone. So that automatically opens up our avenues to offering more services within the same period of time in multiple formats, and availing of that service can be done in a much more structured manner without having to go through a huge crowd, which is very typical of physical service delivery. So I think that's one aspect where you're looking at technology and the new ways of looking at things, changing all services. You'd asked me a very question on humble workstation. The humble workstation is really looking humble, but it's all powerful. Okay, and it's a very silent player and a very powerful player. And the workstation, because it's now enabled with voice services, it's enabled with facial recognition services, it's enabled with touch services. It is becoming much more mobility friendly and traditional desk based, and with its ability to having good imaging services, the high definition picture quality that exists, and the availability of it in multiple sizes, whether it is 11 inch, 12 inch to anything as big as a 25, 30 inch, whatever is suits well on a table or on a comfort. I think the combination of all of this allows it to be a very powerful compute device
Mm.
with the Omni experience and the ability for it to be a device that is mobile friendly. When I say mobile friendly, travel friendly, I can see it in my car if it's a typical 15-inch tablet based device, versus a traditional desktop. And with the ability for these workstations in all the formats, now a tablet is becoming a workstation, and a workstation is becoming a tablet. You can see them detachable, and all those comfort features are there. And with them being able to connect to all the mobile networks, so you can work in a traditional network as well as work in 3G, 4G, or a mobile hotspot, and still the compute abilities and the service abilities of the workstation is not reducing its rendering ability. I think that's a very powerful way by which service on these devices can be taken. So now if I have to take healthcare in such like, devices, and if they are mobile, so if I go house to house on a particular mobile on a healthcare campaign drive, I can still have all of it in the same tablet or device, and it's still that much more powerful. And because in that aspect we can make a virtual connection immediately available. So if the doctor may be in the remote area, or the doctor may be in the hospital because he's looking at multiple, just like the case I mentioned before, and the doctor is also able to take 15 minutes to discuss with the social worker or the healthcare worker who's going to the point of care. Always everything need not be village. It can also be the urban areas where health. So it's all about going to point of care.
In fact, the whole concept of telemedicine, Arvind, something that at Apollo Hospitals is using cutting edge technology to ensure that agnostic of geographical barriers, doctors and potential patients perhaps, or people in need are able to connect with each other. How's that playing out really?
Well, that's a very, very powerful solution that aids healthcare delivery. And you have to look at it in multiple aspects also. It is not only telemedicine or teleconsultation or the various aspects of you have a EICU where you can monitor ICUs across. You have teleradiology, telepathology, tele-ECG reading. All of it are available. And also the interaction that doctors can have. So when it is oncology services at Apollo hospitals, you look at tumor boards and you have experts from all around the world having the longitudinal medical record and the images. Talk to the, look at the information, consult, determine a plan of care, and then have a conversation with the family members on the plan of care, the diagnosis, the prognosis of the treatment patterns. That is extremely powerful in terms of care being provided versus just waiting for all those experts to come to a particular place. Sometimes may not be possible because of their schedules, travel abilities, cost. All of those can be eliminated, and you have multiple experts weighing in on it. Is the best of healthcare brought to the patient and the best quality of healthcare. This is where driving clinical excellence becomes so doable, so possible. I'm trying not to use the word easy.
Yeah.
It can have a different connotation, but really my colloquial word is wanting to say easy because you have that ability for experts to come in together. Of course, healthcare is difficult. A difficult diagnosis is cumbersome and requires a lot of analysis by the care providers, the clinicians, the doctors, but giving them those tools gives them that ability to ensure that care can be provided. Several aspects of teleradiology, telepathology, uh, ECGs being sent out, read and moved out. EICUs where tertiary care hospitals like our hospitals are able to monitor other smaller hospitals. All of this also, this is about, don't always think that this is about something that is very hugely separated from geography. Just look at it. A doctor is in his outpatient, let's say in the ground floor. The patient is admitted in the ward, let's say in the third floor. And let's say the results of that patient have come in. Very typically, what would have happened? The junior doctor or the nurse would have called this doctor, or they would have come in into this OPD and said, given him some information. The doctor would have seen it and said, okay, I'm going to take some time off my outpatients and go to the ward and check out the patient. Today, all of that can be done with the consultation, telemedicine networks that are there. The nurses and the junior doctors, the peers or the doctors can hook up the telemedicine pod at the point of care. They can quickly discuss it while this doctor is in his other work area. And that ability to ensure that time is not wasted and care is given at point of service by the right set of people, irrespective of where they are. And like I gave you an example of ground floor and third floor. Now, it won't take anybody a few minutes to run up to the third floor. But you know what? It's not required. So you know that you have access. The whole comfort here is access. And that guided by the huge compute power that we have that gets into algorithms, machine learning, AI, all those disruptive technologies, bringing evidence-based care into point of service.
True, true.
And that's really the power of technology coming all together, delivered through what you call this humble workstation, which I think is the smartest one and just is looking humble, but
I couldn't agree more. So Arvind, it brings me to one interesting point, because you made a set of very, very powerful points that are kind of helping a lot of us peer into the future in a more educated manner, if I may be allowed to. But really, if I were to look at two kinds of scenarios, one was pre-23rd of March, when, well, the enormous intensity of the disruption wasn't overtly clear. And as we sit today on the 27th of May, a lot of organizations had put in a very phased approach to their entire modernization and transformation journeys through the course of 2020. Well, a lot of that has gone up and pretty much flown out of the window. So I'd like to understand your views, both from a healthcare perspective, specifically for Apollo Hospitals, as well as in your reading as an industry leader who spent decades getting his hands dirty with technology, modernization, transformation, future-proofing business strategies. Do you think that modernization and transformation projects that leverage technology at the very core foundational piece are, well, going to, have they found an impetus or a catalyst to speeden things up as we slowly come out of a lockdown and the disruption? Do you think that modernization and transformation will really kind of speeden up with an organization starting with Apollo, or do you think it'll play out in a different kind of a journey?
Situation we are faced in today is disappointing. It's unprecedented. We have no learning or prior experience with handling something like this. Like I said before, it brings in a unique perspective into appreciating the magnitude of risk. It brings in a unique perspective of the perils of disruption. At the same time, again, I don't want to sound overly confident and or sound like a soothsayer where I said where I would like to say I told you so. You know, every uh, every technologist I'm sure would have said, there are these very many use cases that can be done, and from a probability to occurrence standpoint, would have said it's a low probability event, and now you see that the probability is almost touching one. So what the situation has presented itself to almost everybody is the art of possible. I really don't want to call this impossible, but the art of possible. A very uh, real-time picture has been presented into how technology can enable accessibility, whether it is healthcare or non-healthcare. You're seeing almost all knowledge workers working, and knowledge worker industry is so big in terms of the economy. Now working from home, so I'm talking about accessibility. Then I'm talking about availability, ensuring that all the services are available at the same level in which normal operations, which pre-March 20th were physical. We had to meet
Yes.
each other, and that's what I'm calling as normal. For some time in the future, we're going to call that normal, and then I'm already hearing the words new normal.
New normal now.
So,
Quite the abused word lately it's become.
yeah. So it's the pre-corona normal and the post-corona normal. And but accessibility, we've got a definitive understanding of how technology can help there. Availability, we've got clear examples of how it can be there. And during this period, every organization has been struggling to ensure that it meets its commitment to stakeholders, healthcare users. Hey, everybody has been trying to do it. Nobody has been shying away from it. And everybody is trying to also say that, look, all our services, and this is something that almost every organization industry is saying, look, our services are at the same level as you always expected it to be. We've not brought down our levels of service. That means quality. So the golden triangle of accessibility, availability, and quality is now protected with technology being a very, very, very strong backbone. Pre-March 20th, this was an innovative idea. It was out of the box thinking. Today, its necessity is felt beyond words. God willing and God forbid that we don't have another situation on this planet ever again. So
God
it's
willing.
like phase 2 of anything. We don't want another phase. We've seen the ugliest phase that is there to see, and I think we don't want to see any more of.
Amen to that. Amen to that completely.
But it has shown a certain option and a potential. It has shown a new economic model of sustainability. It has opened up a new model of how services can be delivered. Because of it, certain traditional services, as we have been consuming today, have been disrupted. Unfortunately, there have been job losses also in those sectors, very unfortunately. But it is, like I said, I'm talking about the art of possible. Certain sectors have opened up. So I think we are going to look at capitalizing technology-enabled service delivery, technology-enabled quality delivery, technology-enabled accessibility. And in healthcare, it is probably going to ensure that the quality of services are going to become much more higher and higher than they are there, which necessarily means that clinical outcomes, quality outcomes, satisfaction outcomes will be driven higher. That means every organization, every service provider, everybody will be much more aware and monitoring it. Aware is one. Monitoring is a whole different change in mindset. And that means you're going to bring it into your standard operating processes to be monitoring regularly never to let down qualities and service levels. That means outcomes will always be high. That is a very, very positive and delightful state to be. It is very sad that it has happened from a very bad situation.
Sure.
But you know what? That's why I said it's the art of the possible. So I would see every industry, definitely healthcare has seen, and at Apollo hospitals, you asked me how we've been at Apollo hospitals because we drive this from our mission statement. We have been always pushing ourselves to ensure that we bring in technology at every work process. Having said that, even for us, this unprecedented situation is a massive learning. Nobody in their mind thought the probability of occurrence would be so high. While at our organization at Apollo, we've been ensuring that we bring in all these services at the best level. So it's only going to push us even more to better our services, bring them to a high degree of sophistication, much more than quantums more than what we had before. So that's how I see all of this coming.
Very interesting. So Arvind, from a healthcare point of view, and like you rightly said, if you were to look at the golden triangle of accessibility, availability, and quality, a clear picture emerges where there's going to be increased, and like you said, it's also built into Apollo Hospital's mission statement, where you bring technology into daily operations and help save lives, protect lives. What I also want to understand, therefore, is what are those new, or what are those areas that were hitherto untouched, or well, did not see the implosion of technology within their business processes and strategies within the hospital and the healthcare process and their entire chain, really, where we will perhaps see a lot more use of modernization, technology, and transformation?
It will be a mixture of traditional technology and disruptive technology. Clearly, when we want to ensure that our data is communicating effectively as information at the right place, in the right format, to the right set of people, in the right manner in which it needs to be communicated, in the right perspective that it needs to present itself, in the neutrality of the perspective also that it needs to present itself. I think all those are very, very important. And for that, I think there's going to be a lot of importance given to predictive analytics and big data analytics. So that's one area where we will take our huge data and find out what and all the data is talking to us. And from there, make models of predictability or prescriptive. So once we learn from something, we can definitely be prescriptive. And this is going to further ensure that the quality of service is going to improve. So both prescriptive analytics and predictive analytics through the big data mining is going to definitely see better ways. Using this, powering algorithms, pathways, and protocols so that they are guided by evidence-based practice at point of care. And the data is talking at point of care.
That's
and
important.
Data that is representative of the point of care. It's very, very important. Data representing at point of care, using its analytics, transforming and providing insights at point of care is going to help speed to diagnosis. The moment you have the ability for speed to diagnosis, you can speeden up the diagnosis process and ensure that you get to the pathway of the treatment protocols faster. Clearly, this is going to save time. It is definitely going to save money because you don't need to keep doing lots of explorative diagnosis to arrive at a point for the treatment patterns to begin. That means length of stay is going to reduce. That means outcomes are definitely going to increase because you're catching it early, catching it quicker. And this is further going to ensure that the focus, and I'm talking particularly on healthcare, the focus will shift also in terms of wellness and keeping those aspects of wellness in control. So that way, those who are well continue to be well. Those who have certain uh, diseases or diagnosis, lifestyle related or non-communicable diseases like hypertension or diabetes or things like that, are living with that condition in a very well monitored manner, where technology and monitoring. So this is where IoTs will start coming into picture. So you have good IoTs using the good communication devices, Bluetooth, Zigbee, so many communication protocols. Those are protocols, but those can be done very well. And then you have these at a good monitored level. So look at it in terms of the state of health of a society is well monitored. That means those who need tertiary care get more attention. And the overall health system, because of the good use of analytics as well as IoTs, is not bogged down by the tertiary care that is required. And now, like what we discussed earlier, mobility will start making a very, very big aspect, because it gives that omnipresent ability. And when I say mobility, it is not only for the consumer. Immediately, it's not about an app sitting in the hands of a consumer. Yes, it's a very important. B2C is a very important part. The B2B is a very big part of healthcare. So all members, and here whenever we talk of healthcare, it is not only the clinical people, it is also the administrative people who are the people behind the scenes who are making healthcare delivery possible. So the operations will be much more effective, the operations will be much more intelligent, the operations will be much more prepared, the operations will be much more planned. So all of this will be there. And putting this all together, obviously, tons of data is getting generated, petabytes, and furthermore, the cloud is going to become an effective one. But with all this optimism, I'm also going to mention that
the necessary caveat.
There is a caveat. There's a caveat that one, service providers in the technology industry should help all the service industries, including healthcare, in keeping these costs rational to the capability of the Indian economy. We cannot go by a Western economy model of pricing at an Indian economy model. But if we find that model, the ability for the technology industry to thrive with the service industry, in particular the healthcare industry, is very powerful. And in all of this, again, I see jobs getting created by the combination of all these industries coming together. Larger aspects of the society and the national economy definitely improving at faster levels of projection than what we are seeing currently from the financial experts. But that's something that's very, very possible, all of this working. The other aspect that is also going to further, and I definitely expect this to happen in good faith, is robotics enabled processes. Robotic surgery is something that we do very well at Apollo hospitals. Our clinicians are, I'd love to call them absolute experts at it. They're so good at it. I'm not a clinician, so not qualified to explain really what they do. And I'll probably be doing a disservice by explaining what they do. But the manner in which they put robotic surgery into gives that precision. And precision medicine in complicated tertiary care is a very powerful tool set that can ensure that clinical outcomes are always the best of the best. And now with a lot of thrust on contactless operations.
True.
Unfortunately, the virus spreads by contact, and limiting the contact is going to be most useful and advisable also. We're going to have a lot of robotic and powered processes. So I think the innovation industry here is going to see a little more, creativity, because lots of operating work processes will become robotics enabled. Something like a robotic enabled tray, things like that. All those will bring in a new degree of delight, because I'm sure it will be good fun to watch, but also a delight from a consumer experience. Again, ensuring that quality and precision are never compromised. And at the same time, all of this is well controlled from an overall total cost of ownership. This is not some esoteric technology discussion where the cost of ownership is unprecedented. No, we are talking at affordabilities that the Indian economy can afford, thereby ensuring there's no disruption to the payments paradigm, or the collections paradigm, or the affordability paradigm. All of it will be still maintained. I think our nation definitely will stand to gain by technology. Our nation is pretty good at innovation and bringing technology to life. That is something that I see as a good forecast for what can happen post this difficult period.
No, very, very powerful points there, Arvind, and I perhaps couldn't agree with you more. Uh, but if I were to ask you a very important question, now a lot of our viewers are IT practitioners, CIOs, IT leaders, and so on and so forth. Uh, what would be your essential guidance to them as they return to a sense of normalcy within their organizations? What would be your advice, Arvind, to help them focus on the things that are most critical? What would be your three key pieces of advice when the work resumes in this new fashion?
When work resumes in a new fashion, and it's some of it people will be going through, even though they are in a lockdown stage or in a semi-lockdown stage, whichever be the case. I think for all technology players, technology providers, uh, I think one aspect, one eye-opening aspect, is to open ourselves, and I'm looking at it from the inside out rather than the outside in, from the inside out. Open ourselves to a little more disruptive work processes. What we would have been very eager to shut down as not possible or difficult to do in the earlier ways of it, be open. Be open with an eye on process and sustainability. Be open with an eye for being effective from a quality standpoint. Quality of service is very important. Sustainability of the service is very important. And be effective so that it can have an execution model at costs of ownership that are congenial to our organization. Uh, it's a little bit of a rude shake for everybody, but I think it's brought in a unique understanding for bringing in disruptive services into mainstream. Earlier, disruptive services were only part of innovation and showcasing. Now it is center stage. I think we need to acknowledge it and not feel threatened. That means the industry also should be open to continuous learning and continuous implementation. That means all of us as technologists go back to school. There are virtual schools available today. Keep ourselves abreast with all the technology that is possible. Keep ourselves open to innovation and focus very hard on speed to execution, because the industry and the economy today is not in a stage to merely appreciate the possibility of technology. The industry and the economy and the stakeholders are violently looking for execution that can get results. It sounds like management talk, pressure tactics, but it is not. We are all seeing the economy around us. We are all experiencing around us. We are all expecting results around us. We all have a sense of urgency. That sense of urgency sometimes is governed by fear. That sense of urgency sometimes is governed by the lack of information, or the feeling of being helpless because the situation, you don't know what's going to pan out. With this thought in mind, I think very strong focus on how we can get to a good, agile, constructive execution process with a combination of disruptive and traditional technologies, ensuring that return on investment as well as total cost of ownership is kept, and at no point in time sustainability or quality or execution is let off guard. I think all of this is something very, very critical that all of us need to do. At the same time, now I said inside out. And for a very typical technology person, the most common thing that you will hear is we have everything. It's been there for the longest time. Users are never noticed. I think we need to reach out more to segments so that we educate them. And here is a call to all the user groups also, the consumers, the stakeholders, to consider the aspects of technology that can do better. That means there is going to be disruption for them also. And for them to openly embrace it and still ensure that their outcomes are protected. But some of the means will be changed. It cannot happen in the same means that this was happening. So a call for openness from the stakeholder side also to embrace all of this in a meaningful manner. That means be open to some of the changes. And at the same time, for my own technology friends, providers and suppliers, to ensure that they understand these fears and ensure they play towards overcoming them. And to the overall economy that any organization, chief execution officers would be worried about keeping cost at viable areas
and limits.
and keep it at bringing innovation models of costing. This is the chance to do that. When we bring all of this together, I see promise. It's just not futuristic thinking, but I think we're experiencing some of it today. Just to not let go of something that is a crisis that we can turn into an opportunity, a crisis that we can turn into a changed way of thinking. That's going to be beneficial for all of us put together. I think we should not let go of a good crisis and turn it into a good opportunity. Sir Winston Churchill did say that never let go of a good crisis, but I think even more meaningful in
today's day and age. And in conclusion, I do have a view on the clock, Arvind. Plus, we realize being a weekday, your schedule's busy. Thank you for joining us. But in conclusion, really, what's been the one single biggest learning, Arvind Sivaramakrishnan, from this entire disruption that industry and the globe really and humanity has faced?
I think one part is never underestimate the power of nature.
That's
I think and never underestimate risk and how risk can get mitigated, and be very, very open to constructive models enabled and powered by technology. Very strong focus on quality and extremely strong focus on sustainability and execution. Execution at the speed in which the stakeholders want, execution in which the economy and the market is expecting, never letting go of stakeholders' expectation, irrespective of the difficult situation. I think all of this is learning that has been reinforced on us in this difficult time, but I'm hoping that this learning will turn ourselves into some good that will come forward. I think we've got exciting times coming forward for us. I think the cloudy gloom will go away. There will be brightness. As humanity, we've always been resurgent. That's why we've got the sixth sense. So I think our intellect will prevail. So I think I'm optimistic about what the future is going to bring to all of us. Let's shed off the difficult period we've had, but let's ensure that we take the learning forward.
Lovely. Arvind, Sivaramakrishnan, I deeply grateful that you could make time out today. It has been a privilege for us to hear your views, privilege for us to have heard the depths of honesty with which you've actually given other folks who are hearing this and the wider audience uh, the hope that uh, one just has to stay positive and that I think that the key point that we've all taken back today is that the future is going to be the art of the possible more than anything else. Thank you so very much. It has been delightful having you with us.
Thank you, Arvind.
Ladies and gentlemen, that was Arjun Vishwanathan in conversation with the man in the hot seat, CIO of Apollo Hospitals, Arvind Sivaramakrishnan. We will take a pause now. Stay tuned in for more. Thank you very much for joining in. You've been a brilliant audience too. Thank you so very much. Hello and welcome back to this episode of the Digital Dialogues. I am now in conversation with industry experts on the views around innovation and transformative solutions that can add value to industry efforts to march forward in what is truly the digital economy. And without further ado, let me introduce my very, very eminent panelists. I have the pleasure of welcoming Suhas Pingat, Dell Technologies. Welcome, Suhas. Happy you could be here with us today. Saji
Hello.
Kumar, Director M&A Alliances, Microsoft. Saji, thank you for being with us today again. And Ramaprasad Srinivasan, Director Public Sector Sales, Client Computing Group, Intel.
Thank you.
Pleasure that all of you could join us. Just a short while back, I was in a very interesting conversation with Arvind Sivaramakrishnan, CIO Apollo Hospitals, uh, trying to peer into the future of what healthcare of the future in India is going to be with its inclusivity, and most importantly, on how the foundational elements of technology are going to help propel the future of healthcare forward in India. Uh, from amongst the very many points that Arvind brought into this conversation, and very powerful points, really, uh, he made a statement and held forth on how the so-called humble workstation is essentially a very, very powerful tool that will help drive a lot of inclusivity and business outcomes on the ground at the point or the moment of truth. Now, when you kind of look at it in that manner, and Suhas, with your permission, if I could come to you, what really are your views? Because you just heard Arvind speak about that. If I could hear your views from the perspective of the kind of work that you're doing at Dell Technologies.
Yeah, well, Arjun, thanks. I think the workstation is no more humble. It's been a pretty long journey for everybody in the industry. But from that perspective, what has changed drastically is, just to set the context right here, is the immense change in technology that has happened over the last, I would say, decade or so. And this change has essentially happened in compute and in visualization and graphics. So what used to be the domain of, let's say, a huge enterprise level system is now available at the desk of a user, a creative or compute. And of course, with the change in technology, it is now available with the mobile workforce as well. So the workstation, purely from a technology standpoint, is no more limited to the desk. It can now move straight to the field as well. Now, that changes a lot of things, actually speaking, in the healthcare industry. Now, a couple of things that we are currently doing is business as usual, which means we're talking about telemedicine, we're talking about PACS, we're talking about EMR and EHR, which is now also changing rapidly. But there are a few things that are going to change, and I think we're going to see that, and they are work in progress, of course. So one is from a compute standpoint, and how much of data can you compute at the end user level? Okay, the compute at the enterprise level is super high, but how much of it can be done rapidly for us to gain the responses as quickly as possible? And that's where things have changed. From the creative aspect, from seeing and visualizing, a lot of things have changed drastically thanks to our friends in the graphic industry, in the graphic hardware industry. So I see that as a change. I also see virtual reality to a very great extent still limited, but can be utilized effectively if you compare it to the adoption in certain nations across the world. So we can look at it from a surgery planning perspective. We can look at it from an education perspective as well. Uh, these are a few things that I see immediate impact. And last but not the least, what I also feel is very important is from a drug discovery perspective and considering how things are changing today, I think that is also going to gain more and more momentum where we start utilizing the techniques that are available within the artificial intelligence. It could be machine learning, deep learning, drawing certain inferences. So that is going to change the way a lot of our people, a lot of our friends in the healthcare industry are going to take decisions which are quicker, faster, and more accurate.
Indeed, indeed.
So that's where I can give you these few insights.
Very, very, very interesting. And Ram, if I may come to you on pretty much the same question. The modernization of frontline endpoint devices is clearly leading to very, very transformative benefits and the achievement of sustainable business outcomes. At Intel, how do you power that very, very critical and important need in industry today, from a healthcare perspective as well as perhaps?
Yeah, Arjun, yeah, thanks for the question. And I'd just like to add what Suhas mentioned, and we know we do have a very strong collaboration with Dell as a partner anyway. Our story has always been around driving more performance, right? Delivering more and more performance. And roughly you can think of what used to be the domain of supercomputers now in the palm of your hand, roughly. And that's what I think Suhas was also mentioning. The workstation is no longer just humble, right? What it can deliver, it really packs a punch. And it's mobile as well. So it can get to where you are. And that is going to redefine some of the capabilities that's available at the edge. And I think what I also believe is the performance that we put on the platform and how it's brought to life by our partners such as Dell and in collaboration with Microsoft. It really brings out certain capabilities which will truly transform the way telemedicine is going to be looked at in the future, right? And we had people referring to analytics at the edge, which is very important, right? We are generating a humongous amount of data across all segments, more so in the field of medicine. It could be MRIs, imagery, what have you, right? Being able to analyze them better and in real time, quickly as possible. That's where the future is going to be moving towards. And that is going to deliver, as I said, more and more capabilities at the edge. So the healthcare professionals can deliver more accurate and much faster turnaround in terms of diagnostics, which could lead to more clarity in medicine as well.
Interesting. Saji, if I may come to you with the same concept, from Microsoft's perspective, what is it that your views would be if you were to be able to peer into the future from the context of the disruption today?
Yeah, Arjun, very, very relevant and good question. And I completely agree to what my friends Ram from Intel and Suhas from Dell has said, right? So let me start with what is the mission of Microsoft. So we say we empower every person and every organization in the planet to achieve more. Digital transformation has been one of the biggest changes any of us have seen in a lifetime in every aspect of life, be it your travel, be it your medical, be it your education, healthcare, whatever it is. And we know how critical healthcare as a vertical is all about, right? They need seamless access to the interactive data powered by the intelligent cloud. Right? So like, my friend said, our industry does not respect tradition anymore. It only respects innovation, right? So what is the role of Microsoft? When Dell and Intel is providing the best of the hardware, the most powerful hardware for this particular, industry, what is the role Microsoft will play? You need the right fuel to run this, right? So we have an integrated solution that brings together the best of the productivity tools and most secure in a most secure environment, because security is also going to be a very, very key factor in device management. It enables you to bring your business fully to the cloud, delivering the best that Microsoft has to offer to run and grow your business. So that's the role Microsoft will play in this journey.
Very, very interesting set of points that you've made there, Sajib. And if I may be allowed to continue with you, this current disruption, do you feel that it is but a natural catalyst or the impetus needed for organizations to modernize, and therefore to bring in an ability to see this crisis through the lens of an opportunity? How would you kind of how would you take a stab at that?
So definitely, Arjun, this crisis will certainly catalyze some huge changes, right? certain businesses will not buckle under pressure for sure in this pandemic. They will see increased demand. See, those who are able to adjust to the new normal, those who have the resilience and speed will be the future winners for sure. At Microsoft, our top priority is the health and safety, not only just employees or customers, but the partners and communities as well. Say, for example, if I just take a small deviation, right? Look at Microsoft Teams. It's available to as many people as possible today. We aim to support the public health of the community by keeping teams connected while they work, right? And moreover, we have seen with the end of support of Windows 7, which happened in Jan this year, we have seen a huge traction of customers migrating to Windows 10, which is a more secure and productive platform asset. So net, the message I want to convey is that this crisis is definitely creating a lot more opportunities in the future. Those who can adapt to the new normal, those who can quickly move into the new normal will certainly be the future winners, in my opinion.
Outstanding, outstanding. Suhas, if I may come to you, sir. What is your prescription to technology users and buyers in your ability to bring to the table such solutions that will help them see this crisis and this disruption through the lens of an unprecedented opportunity, however unnatural it may have been?
Thanks, Sachin. I think the problem or the crisis that we're currently seeing is related to the industry that we are actually currently talking about, and that's healthcare.
Healthcare.
Okay? That's one thing which is, to a certain extent, an opportunity, yes. But I think to get it across, and what Saji also mentioned, safety is important. Of course, it is important. But what is going to change is the way people start going around doing the business. And when I say doing the business, it essentially means I may be working from home, but does a frontline worker who's probably part of the entire healthcare industry, can he or she be expected to work from home? I don't think the answer is no. Right?
Perhaps.
And hence, the impact, in my personal opinion, also is going to be very, very huge. And how will technology companies help the healthcare industry evolve and change the way they deliver their solutions to the needy is going to really be a change.
True.
And this has a huge social impact. Let's understand it is medicine, healthcare and education that will move ahead and create two huge social impacts, and especially for a country like India. So it will be relevant for us also to be aware of the social digital cause that we can see moving ahead. And to that aspect, I think remote collaboration, remote consulting, getting people where, or getting healthcare people where it is really, really, really very a critical situation. It's not only productive care, right? It's about how you get the problems analyzed and immediately get a result. It could not be necessarily related to this pandemic. It could be, for that matter, anything that comes up in the next future, coming up. So let's be digitally and socially relevant to people. I think that's where we can make much of a huge impact within the healthcare industry.
Ram, your views on this, please, sir.
No, I think, what Saji mentioned this, and so did Suhas in a different shape and form. I think, this is a new normal, right? I'm sure post this, everyone in every segment, and more so in healthcare, will look at, ways and means of having some kind of mobility and being able to be delivering services at the edge, right, to the end customers, right? So, and being able to work remotely, being able to work from wherever they are, I think will become a critical component. And to that effect, as we deliver more and more performance to them at the edge with strong communication infrastructure. I know we are using 4G now, but upcoming, if you look at the future, will be 5G, and there are trials starting off elsewhere in the world, which is built from the grounds up for more data kind of services, right, with video and so on, imaging. We expect those kind of capabilities, and that, if you're able to put so much of petaflops of performance at the hand of an individual, being able to access petabytes of data within milliseconds, right? Imagine the possibility, right? The only thing what's more amazing than what we do is what people do with it, right? So the kind of capability that it will deliver to the edge, and with partners such as Dell bringing those platforms to life, in collaboration with Microsoft, I'm sure people will look at this. And somebody was joking that who drove the fastest digital transformation in your industry? Unfortunately, this time it's the COVID.
It's
right?
the COVID crisis.
It didn't have to be that way, but
Yeah, it certainly didn't. I mean, the human tragedy first and foremost, which brings me really to, and I do have a view on the clock. Brings me to an interesting question. Three powerhouses, Dell, Intel, Microsoft. How does the kind of symbiotic relationship begin, and where are points and inflections of value that each of you bring, such that you're able to put out those innovative solutions that are going to essentially power organizations' journeys into the future? How does, and Suhas, could I come to you first, please, sir?
Yes, I think that's what we would like to be part of, and at Dell Technologies, and specifically for the business that we're talking about, the Humble Workstation that was discussed is actually Dell Precision, which is of course powered by Intel and of course Microsoft as well from an operating system standpoint. But it's been more than 21 years that we've been part of this industry and moving together, and we've seen the changes moving rapidly. Okay, we're not only talking about mobile workstations, we're talking about rack workstations, we're talking about different level aspects of technologies that will really change the way people use workstations for that matter. And from a Dell technology standpoint, it is not only the workstation. We're talking about the edge to the core to the cloud, right? So which means you get a seamless integration of everything that an organization, a large healthcare organization might have. And the synergies that we work with, in fact, with Intel and Microsoft, it's tremendous. We are obviously, of course, 100% with them. And the collaboration that happens, for example, if in case we want to test an application which is relevant to the healthcare industry, all the three of us come together and ensure that those software applications get tested onto the Dell Precision and get certified. So we have a larger engagement, which is known as the independent software vendor, which can be definitely related to the healthcare industry. And hence, globally, there's a collaboration effort that happens within Microsoft and Intel. So a lot of exciting and amazing stuff is going to come ahead, and I don't have the liberty of telling you what all we're going to plan in this immediate.
We would have loved that, wouldn't we?
Yeah, but it's specifically to mobility, and I think that's where things are going to change drastically.
Outstanding. Ram, if I may come to you, the same question really, and how do you help organizations peer into the future and envision, reimagined realities in the symbiotic relationship that you do?
Yeah, no, thank you for the question. And I think I would like to add what Suhas mentioned, right? Clearly, they bring a lot of what we do to life. We start with the humble SAN, we turn it into powerful microprocessors, and that comes to life through precision workstations, such as what Dell kind of delivered to the marketplace. And clearly, with the performance enhancements we make generation on generation, it is leading to incredible capabilities that gets delivered at the edge, right? And we do work a lot with Dell when they bring out the products, and to ensure that, why somebody needs a real workstation, right? Which is where it just works the way it should. So a lot of the certifications and stuff like that get worked out beforehand, so that the end customer doesn't have to go looking for it. And also we do work very strongly with Microsoft to ensure that a lot of what we put in hardware is utilized by the drivers and the operating system layer above that, and even some of the collaboration tools, so that there's a seamless experience across the board. So yeah, we do collaborate very heavily, and I just want to leave you with one possibility of what it could deliver to us in the future, right? We've all heard of genome sequencing. It's a very, very complex environment which needs a lot of horsepower, right? And if you think of the human genome as a book today, despite all the enhancements we have made, you're only able to read a few paragraphs of it, right? So in the future, with the capability that we can deliver together, you'll be able to read the whole book. And that means billions of genomes being sequenced, right, at a very short period of time. If you think about it, the earliest genome sequence that happened took about 13 years or so across billions of dollars for it to be sequenced once for us to understand. Today, you can do it for a few thousands of dollars. So there is true democratization of the performance being put at the edge to benefit end customers and users as well, right? So reduced cost of sequencing, which could lead to more precision medicine. In fact, people are saying the 21st century would be the era of the precision medicine, because the better you understand your genomes, the more accurate you can get into, and improve quality of life and the future and so on. So yeah, we are at the heart of it, working very closely with our partners, Dell and Microsoft. So thank you for the opportunity. Yeah.
Thanks. Saji, your views there.
Yeah, absolutely. So, like my friend said, right? So we have a very strong collaboration between all these three industry leaders, be it Microsoft, Dell, or Intel, right? One thing which you see a commonality between all these three organizations is their objective. Whenever there is an innovation, there is a development which happens. It not just limited to that particular organization or a particular set of customers or partners. They look at the planet as a whole, how the community can benefit largely based on this innovation. That's why you see a lot of commonality in the key roles and priorities of all these three organizations. Say, for example, Microsoft and Dell enjoys a 4-decade-long partnership globally as well as in the country. Last year, you might have noticed, right, at the Dell Technologies World Forum, both the CEOs came together on the stage and announced that we are expanding the partnership in a number of digital transformation solutions. That itself is a great testimony to the strong collaboration we have as partners. So,
lovely. But I, much as I would like to continue this conversation, that pretty much in this episode is what we have time for. Saji, Suhas, Ram, it has been nothing short of a privilege in being in dialogue with you and hearing your very, very interesting views. Thank you very much. We're very grateful to have had you. For the audience, well, that wraps up this episode. Stay tuned. We will be back again, same time next week, with the next set of the Digital Dialogues with Arjun Vishwanath.
thank you.
Thank you, Arjun. Thanks.
Thank you.
Thank you.
Thank you.